Good morning, everyone. Welcome to the event, Nutrition-Sensitive Agriculture for Healthy Diets in Latin America and the Caribbean, part of the IDB series, Seeds for Food Security. This seminar has been jointly organized by the IDB's Agriculture and Rural Development Division and the Health, Nutrition, and Population Division. For those of you joining us online, please note that this event is being held in English with simultaneous interpretation to Spanish. To activate it, simply click on the globe icon at the bottom of your screen. Este evento se realizará en inglés con traducción simultánea al español. Para activarla, hagan clic en el icono del mundo en la parte inferior de la pantalla. We encourage you to send your questions through the Q&A chat box. We will read them at the end of the session. And now it is my pleasure to invite Pedro Martel, Chief of the Agriculture and Rural Development Division, to deliver the opening remarks.
I don't know how you make this stand here. Hold on. So, good morning, everyone. Buenos días. No, I'm not going to do everything in Spanish and English. Just going to use English. So just for the good morning. Buenos días a todos. And thank you again for joining us in this session. This is our 8th session on the seminar series called Seeds for Food Security. And if you haven't seen the other ones, 7 prior, they're in our YouTube channel. I think it's called, what is it called? IDB's YouTube, or just IDB's YouTube channel. Okay, you can find it there. You can find all the 7 ones prior to this one. It was amazing when I heard the news that we have 8 already. I don't know how it happened, but it's surviving now 8, and we're going on to have 9 or 10 this year, right? Maybe 9, at least 9, hopefully 10 this year, at the end of the year. So, and the goal of the series is to bring together academics, policymakers, practitioners, to explore about these issues of food security and nutrition, food nutrition and security across the region. So it's an area to have debates, have people come from outside, give us new perspectives, and then use the public forum to discuss this idea. So that's why it's very important that if you're in the YouTube channel, just send us the questions. We'll try to air them here on live. And then I'm going to give you some little bit more of the data, just reminding us something that we already know, right? According to FAO, nearly 28% of the region's population, about 187 million people, are food insecure. That's a lot of people. Just to put it in perspective, that's 4 times the population of Argentina, about 15 times the population of Bolivia. That's a lot of people. It's not just a few. And even more concerning, over 22% of the population, or 131 million, cannot afford a healthy diet. That's even more striking, I think, in sense of what we pride ourselves saying we're the powerhouse in agriculture, yet we cannot afford a healthy diet as a region. A large proportion of our population cannot. So historically, we go now to the sector, right? Agriculture interventions have focused on increasing food availability and access by boosting food production. That's where we've focused. And they still are important areas of intervention. We still need to keep an eye on those things. However, today's food security challenges go beyond producing calories. And it's gone beyond for a while. It's just that we haven't been so aware of that need to go beyond the production of calories. And so we must ensure that our food systems, and particularly our agriculture systems, deliver safe, healthy, and nutritious diets. That's very important. That's where we're at in this particular seminar, this particular workshop today, or seminar. The concept of nutrition-sensitive agriculture becomes critical as it's an approach that shifts from focusing on quantity to quality, promoting nutrient-rich crops, dietary diversity, and food fortification. These strategies tackle malnutrition and micronutrient deficiencies. And they just go beyond that, focus on more production and more calories, focusing on what we're eating and what we're producing and what kind of productions we're having. And it calls for innovative cross-sectoral, purposeful interventions that recognize that food nutrition security is a multidimensional issue, and it requires a multi-sectoral approach in their intervention. With that in mind, we're co-hosting this event today, like Soledad said, with our sister division, the Health, Nutrition, and Population Division, and ourselves, the Agriculture, Natural, and Rural Development Division. And in this sense, we want to give not only internally, but outside the idea where we need to break those silos that, health works here, agriculture works here. We need to work closer together. We want to tackle these issues looking into the future, right? Without further ado, and having said that main message, it is my pleasure to welcome our keynote speaker, Dr. Deanna Olney. She's the director of the Nutrition, Diets, and Health Unit at the International Food Policy Research Institute, more commonly known as IFPRI, and leads the CGIAR Group Research Initiative on fruits and vegetables for sustainable healthy diets. She holds a PhD in nutritional biology from the University of California, Davis, and brings over 20 years of experience in international nutrition with work spanning Latin America, Asia, and Africa. Her research focuses on evaluating effectiveness and cost-effectiveness of food systems and multi-sectoral approaches to improving diets, nutrition, health, and overall well-being. After we see her presentation, we're going to have a panel with Sebastian Bauhoff, from our principal economist from the Health, Nutrition, and Population Division. Thank you very much, and welcome, Deanna.
Thank you so much for that nice introduction, and thanks for having me here today. It's great to be here. I was here about a year ago talking about our global food policy report, and so thanks for hosting us again. It's a pleasure to be invited to talk about something that's very close to my heart, something I've been working on for many years since I joined IFPRI about 16 years ago, and that's nutrition sensitive agriculture. What is it? Why do we need it? And how to do it? And then I'll also be talking a bit about the evolution of that thinking into food systems and diet-centered food systems, and how that, the work that we've done on nutrition-sensitive agriculture has evolved to inform our thinking about food systems approaches. And so what are nutrition-sensitive programs? Just to make sure that we're all on the same page about what this actually means. Nutrition-sensitive interventions or programs are those that address the underlying determinants of fetal and child nutrition and development, of food security, having adequate caregiving resources at the maternal, household, and community level, and access to health services in a safe and hygienic environment, and incorporate specific nutrition goals and actions. And so that's really the important part here, is that these are intentionally designed programs or approaches that want to improve diet and nutrition outcomes, and actually think about the impact pathways and how do you actually achieve those. So yes, the social protection program might address the underlying determinants, by reducing food security. A WASH program might, address hygiene issues, but the intentionality of making sure that those programs address diet and nutrition outcomes and thinking about how do you reach that outcome is what makes them nutrition sensitive. And the nutrition-specific interventions are those that typically work through the health sector. They're closer to the direct determinants of malnutrition. So they look at things like food and nutrient intake, so diets, caregiving and parenting practices, feeding practices for infants and young children, and low burden of infectious diseases. So looking at primarily care practices, morbidity, and diets. And so why do we need these? And I think we've heard a bit about some of the statistics, but globally, we're still grappling with addressing undernutrition, and this has been the focus of nutrition work globally for many, many years now. But these problems still exist. They still exist globally. They still exist in Latin America and the Caribbean, where we still find high prevalence of micronutrient deficiencies affecting about 2 billion people worldwide. Stunting is still an issue, including in Latin America and Caribbean, although it is limited to some countries where there's a very high prevalence of stunting still. And globally, it affects about 148 million people. There's about 48 million children who are wasted. I think this is less of a problem in Latin America, but it is still a problem in many other regions, or in some other regions, I should say. But at the same time, as we're still grappling with these issues of undernutrition and how to reduce deficiencies and reduce stunting and things like that, we have this explosion of the prevalence of overweight and obesity, which is affecting about 2.2 billion people worldwide. And in Latin America, the prevalence is about 63% based on recent estimates. And this has increased by nearly 30 percentage points since 1990. So every 10 years or so, there's been about a 10 percentage point increase in the prevalence of overweight and obesity. And so obviously this is something that needs to be stopped and reduced. And the prevalence, I should say, is much higher in Latin America than globally. The global estimate is about 50%, which is still, very high. But Latin America is higher than the global average in that area. And this also is coupled with issues related to high blood pressure, affecting about 1.2 billion people, and about 500 million people have diabetes. And these are considered to be diet-related, non-communicable diseases. And we know that poor quality diets are the primary contributor to all forms of malnutrition, all of these listed here, and it's the leading cause of disease worldwide. And it's been estimated that just improving diets could save 1 in 5 lives. And Pedro also touched on the affordability issue. This is one of the critical factors, and I think in Latin America, this is aside from desirability issues and choice issues, affordability is one of the primary drivers of these dietary problems. And you can see, yes, it's worse in Africa and some parts of Asia, but there's several countries in Latin America that are struggling with affordability. And there is kind of so yeah, I was just about to, is that gonna echo? Is this okay? Okay. But it varies very widely across Latin America. You can see the tiny dot on the map. It's red is Haiti, where the prevalence of the population who can't afford a healthy diet is 87%. So nearly everybody in Haiti. And to kind of a low of 5% in Guyana. So there are, good examples of how countries can address these affordability issues. And you can see also Argentina, has a fairly low prevalence, I think about 8% or so. And so in the next slide, I look at just, now it won't move. But it's not moving, I don't know. Okay, thank you. Magically, you just had to touch the screen. Okay. So in this next slide, I just wanted to take a look at how this has changed over the last 7 or so years since this has been being tracked for a few countries. And these are not selected for any reason except for including kind of the country with the highest prevalence and the country with the lowest prevalence and seeing how that's changed over the last 7 years. And so you can see in Haiti, this has actually increased over the last 7 years from about 78% to 87%. Whereas in Guyana, it's decreased from a high of about 41% down to about 5%. So again, there seems to be some examples of how this can be addressed. Other countries like Chile have also seen some decreases in the prevalence of population who can't afford a healthy diet, but many others are not changing, right? You can look at Mexico, the Dominican Republic, Belize, where you really, although there's a bit of variation, there's overall not much change in this indicator. So there's a lot to learn here, but I would guess that there are some good examples beyond the countries on this graph. I did not do an exhaustive look at this, so it would be good to think about that and see what does this look like across all of the countries in Latin America and the Caribbean. And so IFPRI, I just do a plug for IFPRI, but IFPRI is celebrating its 50th year as an organization. And so our global food policy report this year kind of focused on what have we done, how has the policy environment changed over the last 50 years in the areas that we focus on. And so we did look at, how the nutrition field has evolved and what's been our role in some of this. Like how have we contributed to the evolution of these things? And one of the areas that we have contributed to is the evolution of nutrition sensitive development. And this has been really led by my former boss, Marie Ruel, and other colleagues in our division who work together to really define and conceptualize nutrition sensitive development. And yes, this can be applied to agriculture and has largely been applied to agriculture, but it's also been applied to social safety nets, to education, to health. And common across all of these sectoral actions that you can make nutrition sensitive is the goal of improving women's empowerment, as women play a critical role quite often in household and individual level diets and nutrition outcomes. We've worked together with several partners around the world to think about how to operationalize, how to design nutrition sensitive programs, how to work together to test those, to iterate on them, so that we can optimize impacts, thinking about those program impact pathways, which pathways work, which pathways don't, what does it take to actually achieve diet and nutrition impact through nutrition sensitive programming. We've developed methods to rigorously evaluate these complex types of programs. These are multi-sectoral programs, not only bringing in several different components, but also trying to achieve several different outcomes, right? And so how to evaluate those in a rigorous way to not only understand what impact you achieve, but how is that impact being achieved or not achieved? How much does it cost? What's the relative cost effectiveness? So looking at all those issues together, we've developed methodologies to do that and created guidance and all of that. And then we've also, what we found critical is working with partners, right? And having these close relationships between program implementers, whether they're governments, non-governmental organizations, UN organizations, but pairing those with, rigorous evaluations and strong partnerships, again, to really iterate on these designs and understand, like, how do you think that's going to work? Okay, let's figure out how to test it. And then taking that information back and then informing further designs, because often these types of programs are implemented year on year, right? And so finding ways to improve them will ideally, improve the cost effectiveness of those programs or stop implementation of programs that just aren't effective, right? And then we've also done a lot of review of evidence and revising guidance and things like that. And then, as I mentioned, we've also shifted now more to looking at and thinking about food systems and diet-centered food systems to achieve sustainable, healthy diets. And so thinking about those impact pathways, the pathways through which nutrition-sensitive agriculture is expected to improve diet and nutrition outcomes is through own production, so increasing production of especially nutrient-rich foods. This works in some cases, but in many cases, those commodities are high value and often get sold. And so this is not as obvious as it might think, and so it's important to think about, okay, does that pathway work for this specific commodity? Does that actually lead to children eating more eggs or more fruits and vegetables? Or is it really contributing to income generation, which is another pathway through which these kind of programs can work? And then with income generation, though, you also want to think about then how is that income being used to reinvest in health and nutrition, diet, inputs. And it could be through education and other investments that families might make. The third pathway is through addressing and reducing food prices. So, increasing production, increasing profitability from foods can have an effect on food prices, which can affect the affordability issue. And then, as I mentioned, women's empowerment tends to be critical here, and especially for children's diets and nutrition outcomes. Improving women's empowerment has been shown to be effective. It does have kind of mixed effects on their own nutrition, because sometimes as women get more involved in productive activities, in some cases there can be negative impacts on their own health and nutrition outcomes. Women's time is another pathway through which this can work. And again, there can be mixed results here. In terms of the overall impact evidence, it's been clear that these types of programs can improve production, which has been clear for many years, but they also can pretty reliably improve diet outcomes. And this is especially likely if they're coupled with behavior change communication components or actions to improve women's empowerment. And then if you want to achieve nutrition outcomes, you probably need to layer on other types of interventions like water, sanitation, hygiene, or lipid-based nutrient supplements. However, one of the reasons why nutrition-sensitive agriculture was pushed for so long as a viable way to address nutrition problems was the idea that these kinds of interventions could be sustained or might have spillover benefits to other community members. But the evidence in this area is pretty limited, and in part because there are very limited studies that have been done on this issue. But those that have been done have shown limited evidence of impact. So now I'll just walk you through a couple of examples of what it does mean to design a nutrition-sensitive program. What kind of impacts can you expect? These examples come from other regions, from Burkina Faso, and the next one will be from Sri Lanka. But I think they help illustrate what is possible. And so here, this is a partnership we had with the Helen Keller International, or HKI, for many years, to think about how to improve their homestead food production program as it started, and then evolved to their enhanced homestead food production program. And this was implemented in many countries that HKI worked in, but this evidence comes from Burkina Faso. And here, the nutrition-sensitive components are building on their agriculture approach, and including a nutrition objective and relevant action. So here it included selecting nutrient-rich agriculture products. So in this case, it was poultry and some vegetables. Also targeting the program to women with young children, so nutritionally vulnerable groups, and including a behavior change communication component. And this program showed, you can see the prevalence of dietary diversity. Adequate dietary diversity in this population was very, very low at baseline, nearly zero. And we did see some significant impacts of the program on increasing the prevalence of dietary diversity, or minimum dietary diversity for children over the 2-year period. But it's still very low. And then in anemia is very, very high in Burkina, about 85%. But you can see the control group, which is the plain solid line, there was no change over the 2-year period. But in the two groups that received the Enhanced Homestead Food Production Program, the one that received the BCC through health committee members, there was a significant reduction in the prevalence of anemia. So illustrating here that who gives the BCC and the quality of the BCC also matters. It's not just including BCC and ticking a box, but you need to make sure that it's high quality, it's delivered by the relevant actors in that population. And here we were, there was a belief that maybe older women would be more likely to have an impact, and it was shown that actually that's not true. Health committee members were more trusted, they did more rigorous follow-up, they involved other family members. There are many reasons why it's likely that this group had more of an impact on a more kind of health-related outcome of anemia. And so this program, the EHFP program, was actually intended to not only improve diets and anemia, but it was also intended to reduce stunting. But that failed. There was no impact on stunting in that program. And so we worked together with HKI to think about, okay, what else is needed to reduce stunting in this population? And so we designed a follow-on program and an evaluation where we looked at several other questions, thinking about, okay, what if you expand or extend the length of the program or program exposure at the community level? So we implemented the program in the same areas where the EHFP program was implemented, and then randomly assign the groups to either just looking at for additional exposure at the community level. And there was another treatment arm that looked at adding a wash component or water, sanitation, and hygiene component. And then a third arm looked at the whole package plus a small quantity lipid-based nutrient supplement, which provides about 100 kilocalories and an array of micronutrients. And this was targeted to children 6 to 24 months of age. And so you can see that the added benefit of prior exposure did have an impact on increasing weight for height Z-score, which is a measure of wasting. And then adding the wash component on top of that had an impact on reducing anemia further. And so the longer exposure, there was more reduction in anemia, and then WASH had an even greater impact. And then adding the LNS had a greater impact on reducing anemia, but also had a positive impact on reducing iron deficiency anemia, vitamin A deficiency, and finally on reducing stunting. So, but this is a very, very complete package, that was well implemented and had good take-up. And so taking all of this evidence into consideration, not just the evidence that we generated, but also that others generated, over about a 10 years period, we determined that really these interventions should not primarily be aiming to reduce stunting, which was kind of what they were designed to do in the 2010s to 2020, I should say. But really, we need to be looking at diets. This is what agriculture programs should be held accountable for. They should not be held accountable for reducing stunting, but they should be held accountable for improving diets. If they're not doing that, then this program needs to be rethought if you want to have a nutrition objective. So let's kind of shift the expectations and really look at making sure that they're meeting that first objective of improving diets rather than focusing on outcomes such as stunting. We do believe that agriculture can contribute to reducing micronutrient deficiencies and preventing further increases in prevalence of overweight and obesity. I think there is a role for agriculture there. But then there's still this intentionality. Okay, how do you design those programs to meet those objectives beyond the primary diet objective? And this focus on diets does align with the new SDG indicator of minimum dietary diversity, which is low in many countries worldwide. In Latin America, this maybe is not the biggest problem, but it's still only 73% of women meet the minimum dietary diversity requirements. So there is still room for improvement, and this also varies by country, right? So I think it's as low as 50% and as high as close to 90%. So I think there are many countries in LAC that can focus on dietary diversity, improving dietary diversity. But given the high prevalence of overweight and obesity, you should also be thinking about other dietary outcomes. And Pedro touched on this and looking at overall diet quality. So looking at the balance of energy intake, the unhealthy food intakes, and compare that to, the healthy food intakes. And there are measures to do this, like the Global Dietary Quality Score, that takes all of these things into consideration. And so the next example that I'll show you, this is an example coming from our partnership with the World Food Program. And this was after we had kind of transitioned to thinking about diets as a primary outcome rather than stunting. And so this was an agriculture-based resilience program that they were implementing to address climatic shocks in Sri Lanka. And then they wanted to make that program nutrition sensitive. And this program, again, was primarily designed to address climatic shocks, but it was implemented over the period of COVID-19, several economic crises that hit Sri Lanka at the same time. And so it was actually able to look at, how does this kind of program deal with several types of shocks simultaneously in a country. And so this was primarily the nutrition components here were primarily nutrient-rich foods. So here it was poultry, fish, and some small-scale vegetable farming. But it also, to the nutrition-sensitive component beyond that, was to use a health promotion process, which is similar to a behavior change communication component. And here, looking just at the diet impacts, we did see kind of wide-ranging impacts on increasing micronutrient intake. So this is at the individual level across adults as a group. So polling adults, we saw impacts on thiamine, riboflavin, several micronutrients. But most of these impacts were limited to the diets of men. And its only significant impact for women was on vitamin B12, which comes from animal source foods, which makes sense because a lot of the focus was on fish and fish farming in this study. But so our conclusions were, yes, this kind of approach shows some promise. But if we really want to improve the diets of women who had higher micronutrient deficiencies, we probably need to think a little bit more about how to address those issues and make sure that women are also getting the benefits of these interventions. And so, as I mentioned, we've shifted our thinking from nutrition-sensitive agriculture and these kind of more small-scale programs to thinking about diet-centered food systems approaches. And not to discount the role of nutrition-sensitive agriculture. I do want to say that, where agriculture programs are being implemented, integrating nutrition objectives and actions, I think, is a very valuable approach. But if we want to kind of reach broader, more scalable solutions, the thinking is that we probably need to move to food systems actions and approaches, but centering them around diets. And so this comes from the increase in double burden malnutrition, along with climate change issues And then thinking about not only how to improve diets, but also how to do that in a way that considers environmental considerations. So the primary barriers to sustainable healthy diets revolve around kind of 4 or 5 areas. One is desirability, which I think is a big problem that is undervalued. But people don't make food choices just based on logic. What are the health impacts? What can I afford? But also about what do I want? What do I want to feel? What do I want to look like when I'm eating food, right? And that's why advertising is so effective, right? Because it kind of touches on the emotional, needs of people and makes them feel a certain way, right? And then there's issues around convenience. Having shelf-stable packaged foods is really easy and really convenient in lots of situations, right? And so people don't just always make decisions based on what is the health impact that this choice is going to have on me. And so there's still a lot of work to be done. And I think we're a little bit far behind in our thinking kind of from a health sector, nutrition sector approach on how do you promote healthy foods and kind of combat some of the high value advertising that goes into promoting unhealthy foods. The other issue is affordability, which I think we've talked about, and I think is can't be undersold as something that needs to be addressed worldwide and in Latin America. Accessibility issues are still problematic for many population groups, whether they're rural groups, urban groups that are isolated for various reasons. But making sure that there is that easy access to healthy foods is really important. And this, I think, is also where these issues of packaged shelf-stable foods come in, right? It's very easy to kind of stock up on chips and candy bars and whatever else and make sure you have food at the house, but it's harder to keep perishable nutrient-rich foods on hand when you don't have refrigeration, they're far away, etc. And then there's still issues around availability, maybe not so much in lack, but in I think probably in some countries and some population groups. And a lot of this is driven by seasonality issues that need to be addressed. And then, of course, there's the whole policy and governance issues underlying this. So I won't dwell on this, but just to drive home the fact that I think really thinking about diets, what are the dietary issues that you're trying to address in food systems? What are the dietary realities in the populations you're working in? And then thinking about, okay, what would it take across this food system, working backwards through this food system to make changes that address all these different barriers at the same time or sequentially. But then if you want to have those health and nutrition impacts, you probably do need to couple it with other sectoral actions, either through the health sector, social protection, education, or others. Just spending a couple minutes on food systems actions. So starting with demand and addressing those desirability issues and affordability issues, what could be done? First, again, thinking about the diets of the population you're working with, thinking about food-based dietary guidelines where they exist, how to translate those guidelines into messaging that is, motivating to the population. Maybe thinking about marketing strategies. How can we use what, for-profit companies use to promote their products, to promote things like fruits and vegetables or other nutrient-rich foods? And then this whole idea of you can't just do this through increasing production of maize, right? Like there's more that is needed to address diet and nutrition problems. So those multi-sectoral actions or food systems actions. And then for affordability, first you need to reduce food prices, but also thinking about pro-poor economic growth, investments in scaling up social protection programs, investments in transport, infrastructure, and logistics. So many things that can be done here to address some of the affordability issues. Thinking about food environments, this is where supply and demand come together. This is where people are exposed to what are their choices. And again, there's lots of data on product placement, on labeling, on many things that affect how people make choices. And so I think it's our global responsibility to think about how do we reshape these to support healthier food choices. And this can be increasing access, addressing convenience foods, or maybe making healthier convenience foods, utilizing regulations and policies. And this is, I think, Latin America really leads in this area, leveraging retail marketing and advertising strategies, some of which I just mentioned. So I think this is a really a newer area where people are trying to really understand what are these food environments, how do we look at them, how do we evaluate them, how do we positively change them. So I think this is an area, again, where maybe Latin America can play a lead role given its history and experiences so far. On the supply side, I think these are the more traditional things that people think about, increasing production of nutrient-rich foods. This can include strategies such as increasing crop diversity through intercropping, increasing the use of orphan crops, which are underutilized or neglected crops, fortification, biofortification, which are fairly common strategies for addressing nutrient issues. And then the whole range of things that need to be done around animal source foods. And again, here, I think this maybe is not the biggest issue in Latin America, but in many low and middle income countries, this remains an issue, especially for nutritionally vulnerable populations like young children and pregnant women who have a hard time meeting their nutrient needs without one of these very nutrient dense foods. And even in places where food AS of consumption is high, there's still a lot of issues around safety that need to be considered. And then lastly, the enabling environment. And this is, how do you use policy and governance to really support food systems for sustainable, healthy diets? And this needs to include capacity to develop policies, implement and enforce laws and regulations, deliver public services, and manage trade-offs across nutrition goals and other objectives. Because again, governments are not always, primarily thinking about nutrition, right? There's income issues and trade issues and many other things that governments are concerned about. So managing those trade-offs to make sure that nutrition is on the agenda, if it's appropriate. And then the ability to positively influence this corporate influence. I think that's a big, big area that's not well understood, what can be done there. And then supporting citizens' agency for transforming and leveraging sustainable, healthy diets. And so I just want to briefly mention one approach that we're testing in the CGIAR under the new science program for better diets and nutrition. This came out of the initiative that I led on fruits and vegetables, sustainable, healthy diets. But here we're trying to simultaneously address several of these barriers and define geographic regions. So again, starting with the good understanding of the diets, what are the nutrient issues that we're trying to address? What are the behavioral issues? What are the drivers of those diets? How can we address those through kind of the demand, food environment side of things? But also, what are the supply opportunities for addressing some of those issues? And so we're implementing series of interventions from marketing strategies to issues around the food environment to reducing food loss and waste, improving food safety, and also working on breeding and climate resilient crops and other things. And so here, and we are evaluating this to see what the impact is of kind of the added benefit of the food environment and demand in addition to supply, and looking at this over kind of a 10-year horizon. So in summary, I just want to, reiterate that I think there is good evidence that nutrition sensitive agriculture programs can work to improve diets in addition to their production impacts. But we do need to think a little bit about how to make those actions more sustainable, more scalable. And so again, thinking about food systems and food systems actions with a diet-centered approach. And then again, not forgetting that if we want to really make a difference, making sure that we're working across other sectors as well to leverage those diet improvements to transform into nutrition impacts. So yeah, that's it for me. Thank you so much.
Thank you very much, Deanna, for that insightful presentation. I would like to invite you over to take a seat at the panel, along with Sebastian Bauhoff, Principal Economist of the Health, Nutrition and Population Division, and Pedro Martel, Chief of the Agriculture and Rural Development Division.
That was great.
No, I think it's this demand and supply, and so you have to negotiate in the middle. Thanks so much.
Okay, thanks a lot again, everyone. Excellent presentation. Thanks. I really enjoyed it. And as you were making the presentation, I was going through my history, which is bad. I remember talking to one of my colleagues who was a specialist in Bolivia at the time, and he was very insistent, saying, I want to do research with the energy division. What do you want to do things with the energy division? Is it just to extend the power grid? No, I want to see the impact of refrigerators on food diets and health. And I said, you crazy, man. It's like, and he was really into it. And he actually did the work with colleagues from our energy division, and they were able to show some very positive impact. And I was reminded by that. That actually helped the energy division, not our division, to do some power grid extension. But it was good because it was an angle that I personally had not seen. And when you presented it, it was like it brought back memories of that little encounter with my colleague. You mentioned several things. It was just, it's a rich presentation. It's got a lot of things. It's like almost each slide you can stop and think about it. And maybe there have been dissertations written on almost every one of the pages. I was looking at one of the slides and talking about the impact pathways of nutrition sensitive agriculture to impact on the impact pathways of nutritional sensitive agriculture. You said own production, income generation, food prices, women's empowerment, women's time, women's health and nutrition. And there are many things going on in those pathways and the way you elaborate and design projects. So thinking about that, what would be the most effective, I'm going to put you into the spot, the most effective ways governments can integrate nutrition objectives into agricultural policy programs? And what would be the specific levers or institutional arrangements that have proven successful to do this? How will you go about that, or what you want to comment on that from, so that we can start exchanging. Then Sebastian will probably jump in later.
Okay. Great. Yeah. So, I mean, I think thinking about agriculture policy, the evidence is very clear, right? I mean, I think the need to couple any sort of agriculture production activities, if you want to achieve impact on diets, you need to couple that with a behavior change communication that is well designed, well implemented by the right types of people, right? For those communities. And that might vary, right? That's not always going to be the same for every community. Who do they trust? Who do they want to hear from? Who do they believe? Recently we've been working in Tanzania on some of these issues, and we were told you need to get the religious leaders on board. Like we don't care about the health, we don't care about the health actors as much. We need the religious leaders to tell us that this is important and we should be investing in this, right? And so these things, I think, it's not just super obvious how you go about it. It seems simple, just implement BCC. And we see a lot of organizations doing this, like, yeah, we did it, we did BCC. Like, okay, but what did you do? Like, oh, we, did 3 sessions at the community level with, 200 people and, talked about, 10 different messages. Like, okay, maybe that's great. That's a good start, but, it's probably not going to have the type of impact you want, right? Because people need, reiteration. They need to think about what's keeping them from achieving those behaviors. Maybe they need less messages, and so I think the simpler, high quality, what are the 2 or 3 things you really want to change, and then do that well, right? And so I think that is something you can integrate in policy, very specific ask to couple that with behavior change, get multiple actors involved, get the farmers involved, get the, community leaders involved, whoever those are, as well as the people you're trying to reach. And most likely those should be, both women and men. Maybe you need to start early in adolescence, so people are learning this at a time when they're starting to make their own ideas, make their own decisions, and influence those things early, and not wait till, people are 30, 40, 50 years old and maybe less likely to want to make changes in their life. And so just including BCC, but again, being very thoughtful about that. And the more I think about this issue, the simpler I think it needs to be, right? I don't think we should be trying to change 20 different things at the same time. People can't think about that. They can't do it, right? It seems unmanageable if you throw 20 different things at someone that now they have to do, right? But 2, 3 things maybe, right? And then get that messaging right. I really think we need to think about marketing, and doing this differently, not just the standard, yes, eat fruits and vegetables, they will help you, right? Like it's important for diet. but like, how do you, and Gain's doing some interesting work in this area. Like, how do you kind of elicit the emotion, that feeling, like, I want to be like that person that's eating a banana or whatever it might be, right? But I think we just have to get smarter about that. And I think that's something you can work with governments on, like they're the type of groups that have the kind of investment or the access to the types of investments that would be needed. The other issue is really thinking about women's empowerment and making sure that we are not just targeting women, but really trying to work with them to have agency, to have control over resources, so that they have more of a say in those decisions. And that, again, varies by country and context. What are the dynamics that need to be addressed? And then getting that male support, right? So it's not just about women doing more, but like also like, how do you get men on board to support these types of investments that are needed at the household level? So yeah, I don't know if that answers your question, but those are the two things I would really mention.
Yeah, Sebastian.
Yeah, I would just ask the same question about from the health side. I guess that's why sort of the supply and demand here. But maybe just a quick reflection. I really liked in your presentation the emphasis of this shift towards diet. I think from the health perspective, that gives us an entry point, I guess, into the conversation more easily. This is something that health people understand better than just food. Yeah. So I think that's an interesting opportunity for us. We're a relatively newly renamed division, now health, nutrition, population, and sort of looking for ways to engage maybe from the health side, but also otherwise into that space. And the diet sort of road, I think, is a good one for us to take, and sort of easy to think about how the health system might engage not just nutrition specific, but sensitive interventions as well. And I would just love to pick your brain, like partly on the conceptualization of this fresh effort that you presented there. Like, what are your thoughts on the sort of opportunities for health and maybe agriculture together to tackle some of these issues, taking advantage of the fact that we're all of us here?
Yeah, great. Thanks for that question. So yeah, this has been a super interesting collaboration. I mean, we are working with, I don't know how many, probably 40 different organizations across the 4 countries that we're working in, covering expertise in diets, nutrition, health, post-harvest processing, post-harvest loss, food safety, breeding, just like the whole gamut of expertise that's needed, right? And policy, political science experts, and both from kind of the academic side, but also from the government side, from the program implementer side. And when we first started, everyone was like, well, why would you invest in that? Why would you invest in that? That doesn't make sense, because of course we had a fixed amount of money that we could spend. And everyone's like, no, we should invest it all in breeding. No, we should invest it all in BCC or whatever it was, right? And so over the course of those discussions, we're like, okay, we found some balance. We found some, way that we agreed that we should be dividing these resources. And I think, yeah, you need all of it, right? I mean, you need to be thinking about like, okay, how can we produce crops that are more resilient? How can we make sure that those are integrated in farming systems that people respond to and will scale on their own, right? Because eventually the program ends, like farmers need to take up these technologies. They need to see profits from these. They need to see a reason to invest. I mean, some of the information that we've gotten is that, farmers can benefit by reducing pesticide use, for example. They can get better profits and they spend less money, right? But then we're also seeing that the post-harvest piece, the pesticides get reapplied. So like, even though there's savings at the farm level and profits at the farm level, there's a belief that these need to be reapplied so they look nice in the markets, right? And get more profit when the middlemen sell them, and so, okay, fine, now we get them to the market. Now they're being washed in dirty water, reintroducing microbial contamination that we already took care of at the farm level, but now it's reintroduced before it gets sold to the buyer or to the consumer, right? So what are all the little nodes across the food system that need to be addressed, whether it's just to get more food in mouths or safer food in mouths, right? And so I just think there's a wide range of opportunities, whether it's on microbial contamination and disease, whether it's on promoting healthy diets, and then making sure that farmers are, creating that demand so farmers see profits from producing those healthier foods. We've had suggestions for thinking about like organic, value chains that like, and I'm not describing this correctly, but where you have it at the farm and then you have the whole kind of lane of or that shows up in the marketplace and people know to buy from those, and then you label them, right? And see what the market will bear, right? Like, will the market bear those increased investments that are needed to make them, pesticide free, microbial free, whatever it might be. I think on the health side, there's also a lot of opportunity to think about, again, like these marketing strategies and making sure that they're done across multiple channels, right? And lots of people interact with the health system. Can you see the same posters at the health system that you see in the community level? Can you give the same messages in a health visit that you're getting from whatever the intervention is? And again, thinking about very simple few messages, right? That like whatever it is that is needed in those communities, but hitting people from many different sides and making sure you're saying the same message, the same image, right? So you get that kind of repeated exposure. Yeah, maybe I'll leave it there. But I just think there's so many opportunities, but it does take people really like figuring out how to work together and valuing those, like, oh, I didn't think about that. Oh, like that's really interesting. I can see how we can leverage each other's skill sets and goals to make something bigger. Yeah.
So the bombardment continues. We're gonna keep asking. So I like this perspective of keeping it simple, because it focuses each actor's or agent's ability to do something. Because if you are all over the place, even though you have to be all over the place, but each to its own capacity, right? And I think I value that a lot, because it's part of what we have to do. We have to design things that are implementable, and we have to advise governments to do things that are, will take you somewhere. If you give them too much to chew, then you hardly you get frustrated. You don't get the objectives that you're looking for. And I also like that point that Sebastian raised this, and I had written it, nutrition sensitive versus diet center. And that's very interesting, because it makes you think differently in a way. So, and you've given us examples of things that have worked, and you think that you like seeing, and you've given us in this couple of exchanges. I don't know if you've touched on this, and I don't know if you were keeping yourself not to say anything, but what are the barriers that you find to get into this? Because that's the positive side. You show what works. What are the main barriers to get something going, be it either at the government side or at the community side or the business side? What are the main barriers to get something going in this area of work?
Yeah. So, I mean, yes, of course, we tend to want to focus on some of the positives. I mean, I think I did highlight like that first program evaluation I showed. I mean, the big goal was to reduce stunting, and that didn't work, right? Like it just didn't work flat out. There was no impact. I think the biggest barriers that are common across programs, and not just nutrition sensitive agriculture, but programs in general, is poor design, poor implementation, poor quality, right? Like, yeah, the plan on paper makes sense, but actually what gets delivered is a fraction of what was on paper, or it doesn't reach all the people it was supposed to reach, or everyone gets reached, but with like a shovel instead of a package of actionable interventions. And so I think, and it's something that we as evaluators get a bit frustrated with, because you're like, okay, I don't want to come to the conclusion that it could have worked, but it was poorly implemented. There wasn't high enough quality. There wasn't, high enough intensity. People didn't want it. It was just the wrong match for that community. And so I think, yeah, again, just being very intentional about your design. And there's a lot of work going on, about how to approach design differently. We're using human-centered design, really on the demand side, and some of the work we're doing in Tanzania and Sri Lanka right now. So really involving the communities from the start, like what are the problems? What do they want to see? Who are the type of people that who do they envision you're trying to reach? What does that person need? Where do they need to show up? What context does this need to be given in? And, this is where we get some of the insights about, the religious leaders. Like, people will listen to the religious leaders, right? And that may not be something we would have thought of, obviously, like maybe, but maybe not, right? And then, yeah, the capacity to handle all the different messaging. So, but yeah, it comes down to lack of investment, lack of follow-up, and just, people trying to do good, right? But, maybe not doing it well enough from the design phase and then all the way through implementation. And I think sometimes, like from the government side, and I don't know what the audience is here, maybe I'm not supposed to say this, but I think there's a bit of frustration, right? Like you want immediate results, you want those magic bullets, and nutrition sensitive agriculture is not a magic bullet by any means, by any stretch of the imagination. Good programming is not a magic bullet, right? It takes a long time to design good programs, to implement them, to scale them, to get the kinds of results you want. And I think people lose patience, right? Like I think, and we find this with a lot of our donors, right? Like they want to be able to say they've reached 5 million people with an effective program, and they've changed the lives of 50 million people, and that doesn't happen in 2 years, right? And so I think there's a bit of a mismatch between people's expectations and what it actually takes to make significant and sustainable change.
Sure. I'm sorry for, now that I realize we put you in the middle, I think we're coming at you from both sides. I apologize. But maybe shifting gears just a little bit and reflecting of where we're sitting right now as sort of a multilateral development bank. And I think we have a very interesting place in this entire discussion because we're a multi-sectoral bank, of course. And between us, we're engaging with health and agriculture, rural development, social protection, finance, whatever you have. And in many ways, I think this issue of the short-termism, I think for us is also a little bit easier to manage because our engagements are longer term. They involve supporting governments in strategic planning and making investments that even in health take a long time to materialize. Building a hospital or something takes a long while to show up in terms of results. But I wonder from your experience, of now having this Rosetta Stone of the diet, which I think the health people will immediately jump on given the large burden of non-communicable diseases and the sensitivity of those conditions to diet and behavior. I wonder what your experience is in bringing together the two different sectors, if you have any, between health and agriculture, and particularly when it comes to public policy and sort of large-scale policy efforts that are not sort of smaller interventions or sort of trials, if you wish, or localized things, but sort of large-scale national or at least regional and sustained efforts as well. I don't know if you have any insights on that. I think it would be very helpful for us to get your thoughts on that.
Yeah, I mean, I think some of the same principles apply, right? But they're a bit more difficult, right? The higher up you go, from community to regional to national, I think some of these issues become more complex and more entrenched. But I think the same principles apply. Like you need to get all those actors together. You need to get them thinking multi-sectorally, acting sectorally, right? Like what is our common goal? Like how can we together formulate a policy that serves multiple purposes? How can we increase the GDP while also, addressing some of the diet issues? And what are the benefits? You mentioned non-communicable diseases. I mean, that's a huge cost to national governments. The higher those go, the more of a burden it is on national systems, right? And so I think you can make those arguments about, what are the win-wins here? What are the co-benefits that we can have if we design these policies to both, increase our GDP or whatever, the goal is, and also try to address diets. And I think there, where there's a more, think people can understand. And I think that's also where diets is really helpful. I think everyone, can understand what a diet is and what food choices are. I think it's a little harder to conceptualize sometimes stunting or wasting or anemia, and really translate that. Whereas diets, I think, like you said, I think it's something that the health sector can jump on. Anybody can understand what it is. Everybody eats, and so maybe that's something, and people see, unhealthy weights. They see, people going, their family members having to go on dialysis or whatever it is, right? Like get insulin. And so I think people can relate to that. There's a relatability to the diet issue. That maybe agriculture or finance or whichever group you're trying to work with can understand and want to change, So yes, we do. I mean, in all the countries we work in, we do bring together ministries of agriculture, ministries of health, because our idea is not just to test these small things, but also to get them, taken up by governments ultimately, right? And so we do work across sectors. And I think it, takes motivated actors, right? And actors that want to sit in a room and learn, right? And that's not always, again, that's not always obvious, and so finding those like countries where there is this initiative where they maybe have a multi-sectoral nutrition plan, or they have agriculture ministries that are interested in diet nutrition goals, starting in those countries and, getting some good examples going, I think that's one of my biggest learnings is like, I'm not going to go to the country that's most entrenched, it's most isolationist in their thinking. I'm going to go to the ones, for experimentation, for trying to build evidence. For those that actually want to see those changes and are willing to work together.
Awesome, thank you.
We've talked a lot about the, building evidence and generating databases. And well, you didn't say the word generating databases, but we all think of what's going on there. And there's a lot of, I don't know if I want to dwell into this, but there's just briefly maybe on the challenges of this issue of getting the right data at the right moment. And what is it that, we sort of know what we think we need to do on this field, but maybe you can illuminate us, giving us a different perspective on what is it that, given your experience, you've seen that's something that normally in most impact evaluation projects or evidence building programs you think about, but maybe in the diet or center policies, it's a little bit different and you need to think about differently. If you want to complement that.
Yeah, maybe I'll add to this. I think there's potentially, and it'd be great to hear your thoughts on this, a role for the health sector, of course, to collect more information, relevant information, and ideally as simple as possible on diets, on food intake, other kinds of things that are related to this, health behaviors, of course. Some of this we already track, but I think there's an opportunity to do that through the health sector as well. It'd be great to hear your thoughts on this and on how this would be useful. And I would say that within the IDB, of course, many of our health projects have, or our projects in general have results matrices and indicators for impacts and sort of tracking along the way. That's another place of opportunity maybe to generate some of the data that maybe normally would be generated in study, but in our case is often much larger scale policy reforms or interventions. So just to be great to hear your thoughts on how to think about that and how we should maybe as a bank also consider this as including it in our operations.
Yeah, thanks. Yeah, and I do think Latin America has some opportunities here for sure. I think the more institutionalized some of these measures can be, the better for everybody, right? You get better information, you get an opportunity to actually counsel people, right? And then you also create a wider information base. And so I think, yeah, sure. I think especially with NCDs, right? Like those could be, tracked. What is the prevalence of high blood pressure? Who's being treated for high blood pressure? What is the recovery rate, if any? Diabetes, things like that. There are simple dietary measures. On looking at dietary diversity, the MDDW is now SDG. You can apply the same dietary diversity to men. It hasn't been validated for nutrient intake, but there's no reason you can't look at diversity. And it's a very simple questionnaire. It's very quick. It could easily be done during a health visit, depending on how long the health visits are, but you don't need special skills to administer it. So that is something I think that could be done with the health sector. And then again, you can see like if a nurse or somebody is doing that and like, oh, like no fruits and vegetables, like, oh, you only ate staple crops and sugar yesterday, like maybe think about that. Maybe that's an opportunity for direct one-on-one counseling, in the moment, or like what's going on there, right? Like you could create opportunities to have interventions that are built into regular health visits. And we do that for pregnant women, we do that for young children, but maybe it could be broadened, right? And I think, a group that's often missed is adolescents, but could you build those into child visits, things like that? And again, it will depend on how these are going, but maybe not measuring, trying to measure stunting all the time. Like that does take time and special skill actually to get it right. But thinking about these diet indicators, I think where the studies are still useful is, looking at individual dietary intake. You could do it through the health sector, but you do need dietitians. You do need people that are more trained in kind of those more robust measures. They take a bit longer. They take 20, 25 minutes, and so that's probably not something you can do in a routine health visit, but still very useful. And then if coupled with, this more routine diversity, assessments, you could learn a lot and see what that means. So.
Yeah, thank you. Just a quick kind of reflection on that. For us, it's very interesting, and we have lots of issues with non-communicable diseases and having control over those conditions. So in Latin America, overall, maybe a third of diagnosed diabetics have their condition controlled, between 70% don't. And it's not a question of identification. They're already diagnosed. So the question is partly, how do we help them control their condition? And there's, of course, drugs and medicines, but a lot of it has to do with behavior change. And that, of course, has a lot to do with diet. So I think this is why the health sector, I think, is very interested. We see in some disease management programs that are specific for these conditions like hypertension, diabetes. They're setting up, specialized care pathways that include dietitians and other folks. But it's still a very hard nut to crack, to go from this, you have diabetes, and ideally you know it too, which some people don't, but how do we help you achieve control of the condition? And it's not just the medicine part, and it's not just the health visit part, it's behavior change question. And a lot of that is diet related. So I think we see this cropping up, that some countries and some places are making efforts to track diet and use it to inform the self-management of patients. But I think we still have a long way to go on that.
So we could keep going here, but we're gonna give the floor. Anybody from the floor or from the YouTube, or what do we have? I'm sure Giordano wants to ask a question. I see him. He's almost holding the mic.
Put me on the spot. I'll take it. Thank you very much for the presentation. This is very revealing for me. One doubt, no, not doubt, but one question that I have is that, this is a very thorny issue. This is really about changing behavior. And a lot of the discussion was about consumers, about how governments or leaders in the villages can influence the demand side, but not much talk has been going on the supply side and the private sector. For instance, I would assume, because I'm not an expert, is that one of the reasons of poor diets is that unhealthy food is cheaper than healthier food. So the question is, where does the private sector come in, and what work can be done with the private sector, particularly with large firms which produce processed food and all that, in this agenda? Thank you.
Yeah, no, thank you for that question. And yeah, private sector is obviously a big player in this sector, and I think there are opportunities. There's a lot of work going on around how to get private sector, big private sector, to think more about nutrition, right? And they're being scored on, how well they're doing on nutrition and things like that. And I've asked these questions with some of these companies, like what would your motivations be, and it comes down to profit, right? And so I think you need to find, like, how can private sector profit from more nutritious foods in the market, supporting things like fruit and vegetable production. Can they, play a role in getting healthier foods on, into convenience foods? And there's a lot of work going on kind of changing the composition of packaged foods, for example, reducing the salt or the sugar content to lower levels to make them a bit healthier. That's a bit on the margins, right? Like, I do think there's more opportunity than that to, like, really innovate on how can you create healthier products. I think they also have a big role to play in, reducing food loss and waste, improving food safety. I think there's a lot of profitability, opportunities in that space. I do think I would love to see them also contribute to kind of the demand side thinking, right? Like, they obviously are quite successful in getting people to drink their products, eat their products, right? And would they be willing to, also contribute that knowledge and that know-how to promoting healthier foods, And again, I think for them, there are some examples of partnerships that they can support that is kind of a win-win. But again, I think it hasn't really been figured out, right? Like, how to really get private sector acting in the best interest of communities, because their main driver is still profit, right? And so I think you've got to solve that issue of how to make, healthy food, healthy actions more profitable. But I think, you can't be undersold, right? And, like, beyond regulating them, right? Beyond kind of trying to manage those corporations, I think that's not going to be a winning solution, right? Because yeah, you need to get that buy-in, right? And so I think you got to focus on, and again, this is not my area of expertise by any means, but I think you just have to focus on, what's the income opportunities here. Yeah, and I'm looking at my colleague Valeria, and she probably has some thoughts on this, and I think is working on this with this Avanzar 2030 on how to make some of these innovations profitable, not only scale, successful in terms of the outcomes they're trying to achieve. So maybe she could also follow up afterwards, and if you want to come.
Do you want to comment on that? No, you're okay. Yeah. Thanks. This is a very, that's a very challenging question. And not only the question itself, but its reality, right? It's like Deanna said, it's a profitability question as well as, and I'm putting my shoes on the chair of private sector, right? You still want to be in the market. You want to keep that market share. We talked about it the other day on a different context. That's what makes you competitive at the end of the day, right? And we've had ons and off with corporations on this topic. It's also sensitive, and it's also relevant. And I'm sure that as corporations are thinking about it. And I think one of the messages you threw in while you were making that presentation is that we need to think more about marketing, that mindset, which is not natural of the economists or the dietitians, all the health sector. And that's something very interesting, right? Because it makes you, again, bring in different perspectives into this more, into this such an important holistic issue, but it brings other perspectives. I think there's a question, at least or two, maybe one from the YouTube channel, and we'll be wrapping up as we go along.
First of all, we want to say hi. There are over 100 people joining us online. Jose Sanchez from Peru has the following question: how to boost the production of nutraceutical crops to improve food and nutrition in Latin America? In Peru, we have foods such as quinoa, kiwicha, maca, arracacha, camu camu, etc., which have great nutritional potential.
Yeah, so I mean, I think these are the types of crops that you want to be looking at in kind of nutrition sensitive agriculture, and then address, I don't know all those crops and what the specific issues are around those, but, are there, breeding advancements that could be made? Are there, issues around soil fertility? Are there opportunities for intercropping? Like what are the opportunities for each and every one of those crops? And then what's the nutritional value? And does that match what the nutritional needs are of the population, right? And so again, kind of making the case for investment in those kinds of crops. I don't know if how aware everyone is of the VAX initiative that was led by the State Department a few years ago, but that was specifically trying to get these types of underutilized crops, more investments going to those types of crops, and really focusing on kind of soil issues, breeding issues, things like that. But yeah, I think there's a lot of opportunity there.
And one more.
One more? Okay.
And Agapito Flores Cordova asks, how does the system of these programs work for the inclusion of women in agricultural programs?
Yeah, great question. And it can work in many different ways, right? And I think a lot of nutrient-rich foods tend to be, the domain of women. Not everywhere, but in many countries, they tend to be more involved in, the small scale kind of vegetable farming, even poultry, things like that. And so I think if you look at different value chains, you'll see different roles for women. They're also often the sellers at markets, right? And so thinking about what do women need, to be successful in these areas, and what are maybe some of the trade-offs? I've recently been working on, not working myself, but looking at integrating aquaculture, and my eyes are again open to like totally different set of issues that I was unaware of, but there's a lot of negative trade-offs in some of these value chains as well that I think need to be considered. And interventions need to take those things into consideration to make sure that women's empowerment is being supported rather than harmed through some of these things.
We're almost there, so I'm just going to give Sebastian one quick intervention to be wrapping. I'll be making one comment additional, and then I'll pass it on to you.
I'm just going to say thank you, both for inviting us to co-host this event, but also for you to come in and do this presentation. I think for us as a division, it's been very stimulating, and it's a discussion we're having continuously within the building, including with our agriculture and rural development colleagues. So I just wanted to say thanks. I think for us to sort of have this space and also to start thinking about aligning maybe from the agricultural side and from the health side on this, maybe on the diet piece, if that's a useful one to think about. I think there's lots of potential in health, where there's also been a rethinking about how we approach healthcare for people with chronic conditions, and in general moving towards what the health people call people-centered care, which I think lends itself very easily to talking about diet as well, no? Because it's about the person, it's not about the supply side sort of pushing things. And I think amongst us, I think we have many more conversations to go. So I just want to say thanks for not just getting us started really, but sort of for infusing some more substance into this as well. So thank you so much.
Yeah, again, similarly, thank you very much for the presentation and the discussion. And we'll keep talking because it's a lot of things that we can do. And I thought Giordano Paolo was going to bring in the trade issue, which is another issue that it's very important. We had a seminar here on that issue, nutrition and trade, back in a couple of years ago, I think it was. And it's very interesting as well. So we got all of these pieces together, and we got us being more Aggies. We think about how can we produce foods that are nutritious, but also this farmer the activity has to be profitable, right? So you got all of those not countervailing outcomes, but how do you make them sort of reinforce each other, both the profitability and the nutritious part of what you produce or you put in the market. So any final words from you of wisdom so that we can go home very happy?
Yeah, no, thank you. I also want to say thank you so much for inviting me. And all for the thoughtful questions and discussion. I mean, it also gives us a lot to think about, as we move forward with this agenda. I mean, just one plug, I think we've talked a bit about, treating non-communicable diseases, but I think, prevention is always really important. And one thing I did not talk about today is, on diet formation, and when diets are formed, right? And a lot of that, there's a lot of evidence to suggest that happens in utero. So what a woman is eating during pregnancy really matters. What a child is introduced to in the first couple of years of their life really matters. Most dietary preferences are set by age 3, and so continuing to invest in that. Adolescence is another time when people, start having their own money, start making their own decisions. And, the age at which that starts varies by country, but like maybe not just thinking about treating, but like how can we intervene early to make sure that diets start off healthy? People are less likely, to fall into more negative dietary habits that are harder to change once people are older. So yeah, maybe just a plug on that as you guys think about where to go forward. Thanks.
Thank you all for joining us today for this important discussion on nutrition-sensitive agriculture. Please follow our IDB social media channels to stay informed about upcoming events, publications, and more. We appreciate your participation and wish you all a wonderful rest of your day. Thank you.